Hi, folks. Welcome to Addiction Questions and Answers. My name is Emmanuel John. I'm a therapist of more than 30 years. Have specialized with drug and alcohol patients and their families. I currently, 2 days a week, work with a pain treatment clinic, helping people find alternative treatments to pain and helping them deal with their pain. One of the things that a lot of them ask me, and it was a question that was asked by a client there, so that's where our question comes from today. I'll keep that anonymous because of the city I live in. People may know the person's name. The question basically that I get asked a lot is, how do I know if I'm becoming addicted? Or how do I prevent myself from becoming addicted to my pain medications? And it's complicated because of the high addictive potential of opiates. Doesn't mean that it's more addictive than other drugs psychologically, but physiologically it's a very addictive drug. And by that, what we mean is when we take the drug opiate away from someone, the body goes into a very predictable withdrawal. Shaking, sweating, irritability, restlessness, can't sleep sometimes for quite a while. So we know what the physiological addictive state is. So how do we keep, if we have to use these drugs, how do we keep from becoming addicted to them? Some of you who are looking at this for their family members may have this issue as well. So there's some simple things to think about when taking prescribed medication and avoiding the potential of addiction as much as possible. It's always going to be there. The first thing is to take them as directed. One of the problems that people run into, or one of the difficulties that occur, is people say, well, I'm not in that much pain, so I'm not going to take it a lot now. Then I'm in more pain later, so I'll take the one I didn't take earlier. The best thing you can do if you're prescribed opiate medications is to take them exactly as prescribed. If you're told to take one every 6 hours, you take one every 6 hours, whether you feel like you need it or not. Pain is a very difficult thing to treat once it gets ahead of you. So take it as prescribed. How do you know if it's the right amount? If a person that is prescribed pain medications feels high as a result of taking the drug, they're taking too much. A person with legitimate pain issues will not feel the drug in their body at all. They won't feel high, they'll just feel less pain. It's almost as if it wasn't even in their body. When we give people pain medications for short duration, what we usually have is they have no sense of feeling of the pain medication in their body. Then as they get better and the pain decreases, they start to feel woozy, they start to feel queasy, they start to feel even high. So, take them as prescribed. If you start to feel dizzy or high as a result of taking the medication, it's too much. If your pain is unmanageable, that's a discussion you have to have. Take as little of the pain medication as possible, but do it at the same amount every day. Another thing that you want to be careful of is anticipatory pain. That is when, well, I'm going to go to the store with my sister, or I'm going to go to the store with my kids, and I know I'm going to be sitting on a bench at the football game, and I know I'm going to be in more pain, so I'll take extra. That's anticipatory pain. If you have pain, the best thing you can do, because pain still is a signal that you need to be careful, is to take as prescribed no matter what. Just keep that process going. If you have a long-term chronic pain problem, take it as prescribed. If you decide that you want to be off of them, talk to your doctor about it. They may titrate you off of them, or they may lessen it. You can try reduced doses. They come in many different milligrams. Doctors don't make any more for giving you more milligrams or less milligrams. So discuss it with your doctor. Take them as prescribed. Don't save them up and take them when you're going to need them. Don't not take them one day and take them the next day. The best thing you can do is to stay on that medication, to keep a level of it in your system at all times. So I hope that helps. There's always going to be an addictive potential, and most people who use them for long periods are physiologically addicted to them. If we took them away, whether you felt high or not, you're going to have a withdrawal symptoms and withdrawal syndrome that you'll go through. There's not a lot of good stuff out there that isn't narcotic based to treat pain. There's some gabapentin, there's Neurontin, there's a couple of drugs that work. Cymbalta has been used to treat pain as well, which is an SSRI. So discuss alternatives. Obviously there's things like acupuncture and stuff like that. Personally, what I do, I work with a organization that does spinal cord stimulators. It's almost like a TENS unit that we install into the body. It goes under the skin eventually. They usually do a trial first, and it sort of turns up and turns down when needed to sort of interrupt the pain signal getting to the brain. So you still have the problem, but your brain's not feeling the pain. So there are some alternatives. You can investigate those. Any reputable pain organization will help you try to figure out what they are. And again, the thing I was talking about is called spinal cord stimulator. I do talk about addiction somewhat in the books, about having to take medication and prescribed and how people become addicted to opiate medications. And you can find those at addictioninthefamily.com. Or if you have other questions, please feel free to submit it to whytheyuse@gmail.com, or you can go to the Facebook pages for addictioninthefamily.com, or Addiction Why They Use, a handbook for anyone who loves an alcoholic or addict, and the one for the using individual is Addiction Am I Powerless? So check them out. But if you have questions, please, I'd love to have them. This question again comes from a couple different people that I deal with on a regular basis. So I hope that helps. I hope it gives you some insight, and take care of yourself. Thanks.